when you come into the emergency room, make sure they put a mask on you too, okay? All right, come on out. I got a wheelchair right here for you. All right, Mrs. Miller, we're going to get you into this isolation room here in the emergency department. All right, let's get you into this bed here. Hold on, let me put the brakes on. Okay. All right, just come have a seat. Very good. Okay. Dr. Smith,
Can I sit up? Can I sit up, please?
Yeah, here.
Oh, thank you.
How's that?
Oh, that's better.
All right, can you scoot over to the edge a little bit more? All right, I just want to get your temperature and your vital signs real quick.
Okay.
All right, I'm just going to keep this door shut. It needs to be kept shut while you're in this room. Can we take your sweater off, please?
Yeah, I guess so.
Here, let me help you.
Okay.
We'll just go nice and slow. Okay. Very good. So have you been traveling recently?
We went to Colorado over spring break.
Yeah.
My husband and I were celebrating our 30th wedding
Oh,
anniversary.
congratulations.
I
That's
went to-
fantastic.
We went skiing at Breckenridge.
Oh, were you around
I'm glad I
anyone?
wasn't sick while I was there.
Okay. Were you around anyone that was sick?
Not that I know of.
All right, let's take your temperature, okay? All right, that's 101.3. Has it been that high?
No. I have been running a fever, but it's not been that high. Oh, it's been more like 99, 100.
Okay.
Oh,
Your oxygen saturation is 93%.
okay. Oh, this is
That's a
I've
little on the
been
low
coughing the
side.
last couple of days, but today it's just been harder and harder to get my breath. My chest just feels so tight.
Okay. All right, I'm going to take this mask off for just a second. I'm going to put you on a little bit of oxygen and hopefully this will help you breathe a little easier.
Okay.
Who is it? Hold on 1 second. Let me see who's at the door, okay? Let's go ahead and put this mask on. Oh, hi. Come on
Oh,
in.
there you are, Abby. I'm so glad you came. Oh, could you go away for me, please?
Oh, can you let me have that? I'm going to have you go wash your hands, and I'd rather you not touch. Here, you can use some of this alcohol gel right here.
Take care of me.
And then I want you to have a seat over there, please. I'm worried that your mom might have a viral infection, and if it's, it can be really easily transmittable with droplet precautions. So if you could not touch any of her tissues or anything, or if you do, I'd like you to wear some gloves and wash your hands a lot.
Okay.
All right, your blood pressure is 158/88. Is that what it usually is?
Usually it's lower. I do have high blood pressure.
Do you?
Mhm.
Are there any other health problems that you have?
Well, they said a couple of years ago I've got diabetes.
Okay, do you take anything for that?
Yeah, I take oh gosh, what's it called? Metformin.
Okay, do you know how much you take?
Oh gosh, let me think. I think it's 500 milligrams twice a day. Yeah.
And what do you take
500.
for your blood pressure?
It starts with an L.
Lisinopril?
Yes, lisinopril.
Do you know how much of that you take?
That one's just a 10
And
strain.
how many times a day do you take it?
Just once a day. Just
Okay.
once a day.
Do you take any other medications routinely?
No, sometimes I take Tylenol. I've been taking Tylenol and some Advil for this cold and
Okay.
fever and stuff. Yeah, but no, that's pretty much all I take.
Okay. Well, we're going to have to start an IV on you, and I'm going to need some blood work, and I'm
Okay.
also going to have to do a swab and check for flu
Okay.
and any other kind of illnesses that might happen, okay?
Okay.
All right, I'm going to be back in a minute. Are you feeling a little bit better right now?
This oxygen's helping a little bit.
Okay.
Yeah.
All right, well, I've got your call bell right up here, and I'll be back in just a couple minutes, okay?
Thank you, thank you.
Come on, Abby, we're gonna come in. This is our ante room. So this is a special room right outside your mom's room that we're gonna have to get you dressed before you go in. Since we're suspecting that she may have this new coronavirus, that means you need to be protected. Okay? So we're gonna talk a little bit about what you need to do at home. But first of all, we're gonna wash our hands. So right here, we wanna use a good amount of soap, and you wanna scrub your hands for about 20 seconds. Make sure you're getting the tops in between your fingers. And scrub them really, really well. And then when you rinse them, rinse from the top to the bottom so all the germs fall off your fingertips, and then you're going to use your finger. Here, why don't you use the sink? It's a little bit better. Great. And this is good practice when you go home too. You're going to want to wash your hands really frequently, and I'm going to talk to you about disinfecting your house since mom and dad are both ill. Okay, so now we're going to come over here and we need to put on a gown. So this is an isolation gown, and you're going to go ahead and put it on with the opening to the back. There you go. Just like that. There's ties at the top and ties around your waist. Okie dokie. I need to catch up with you. Now I want you to show you how to put on a mask, kind of like what we did. So this is a regular face mask. Can you see how it's yellow on one side and white on the other? The white goes towards your face.
Okay.
So, and then there's a little metal bar here. You're going to put this around your ears. That's what's going to hold it on. I want you to cover up your nose, and then I want you to press the metal. You want to get a nice tight fit, and then make sure you pull the mask under your chin. Very good. Now I'm going to wear a little different mask. Since I have several patients that are ill, I want to protect me and your mom.
Okay.
Okay, and then we're going to put on some gloves. Have you worn rubber gloves before?
Yes, once.
Okay, so just going to put those on. You want to pull them up over your gown sleeve so they're all protected. And so the kind of room your mom is in, it's a negative pressure room, so it's really important to keep the doors closed once we go in.
Okay.
I'm going to grab some of this. We're going to do a nasal swab to check for flu. All right, come on in.
Thank you.
Okay, I'm going to shut the door here. Okay, Miss Miller, we got your IV started and your blood work's off to the lab. The next thing I need to do though is I need to swab your nose, and we're going to check for flu and we're going to check for COVID. We're worried that you might have an exposure to the coronavirus.
Are you serious?
Well, Colorado and Breckenridge is one of the areas where there are infections, and with your symptoms, we just want to make sure. Okay?
Okay.
So I'm going to swab this in your nose.
Is it gonna hurt at all?
It's a little uncomfortable, but I'll be done in just a minute. Ready?
Oh.
I know, I'm sorry. Other side. Okay.
Oh, okay.
Alrighty. All right, Abby, so one of the first things I'm going to tell you is I want you to go home, okay? I'm concerned that with your mom's, we'll have her studies back probably tomorrow, but I'm concerned that if she does have the coronavirus, you and your dad are also very susceptible to it. So, on the cdc.gov site, here's some good instructions on 10 things on how to manage yourself at home.
Okay.
And so one of the first things what you're gonna do when you leave here, you're gonna go back out through this door, you're gonna take off your garb, take off your gloves, your gown, and then at last the mask, throw them in the trash, wash your hands really well, or you can use the hand sanitizer, and then I'd like you to go home. What this talks about here is that if you have any possible or confirmed, you're gonna stay away from home, or stay away from work and school. Are you working right now? Okay, are you still on spring break?
Mhm.
Great, so I really don't want you to go back to school till we know for sure, and what's probably gonna happen is when you get home, I need you monitoring yourself and your dad for symptoms. So, if you develop a cough or a fever, and especially if you're starting to feel fatigued or ill, I need you to call your doctor and have a consultation with them over the phone. Most of the time, we can handle this illness at home with just supportive care, like staying hydrated, rest really well, and then cover your mouth and your nose if you cough or sneeze. Try to do it in your elbow or with a tissue. And when you're done with that tissue, throw it immediately into the trash.
Okay.
Now, is your house set up where the three of you could all stay in separate rooms?
Yeah, we've got 4 bedrooms.
Okay, so you really should all be in separate rooms. Wash your hands as often as you can, and what's best is to sanitize your house, so countertops and those frequently touched items like doorknobs, light switches, TV remotes, your cell phone, all those things, and try to stay away from other people as much as possible. I don't want you guys sharing any equipment, like don't share glasses or plates or silverware, things like that. Wash your linens on a regular basis, and just washing them in regular good temperatures, where it's warm temperatures will be fine enough.
Okay.
And so I'm gonna give this to you.
Is my mom coming home with you?
No, I think she's gonna stay until we get all her results back.
I'll be okay.
And so she's gonna stay here, and I'll make sure that you get the phone number that you can call her, but until we know for sure what's going on, I really don't want you back in the hospital.
I'll be okay. Tell Dad I'll be okay. Y'all don't worry about me.
And I'll give you guys a call later. I have your number, so I will call you and your dad later and let you know how she's doing once we get it confirmed, what we know what's going on with her. Now, when you leave us, I am gonna have you wear a mask when you leave the hospital, because I wanna make sure that if you are infected, that we keep all the other patients safe, okay?
Yes, ma'am.
All right, do you have any questions?
You want me to go now?
Yeah, I think that maybe that's probably the best idea, is get you home where you can rest too.
Okay.
Bye. Bye, honey. Bye.
Okay, I'm gonna see
Love
her
you,
out.
sweetie.
Love you too.
I'll be back. Do you need anything right now?
I'm doing a little bit better.
Okay, good. Hey, Dr. Smartka.
Hello, hello. Hi, Ms. Miller. I'm
Hi.
Dr. Smirka. Dr. Williams called me and let me know a little bit about you. So what's going on right now?
So this is Janet Miller. She's 56 years old. Came in today with shortness of breath, a cough, and a fever. She traveled to Colorado last week to go with her husband. They went skiing in Breckenridge. And then the last 3 days she's been feeling ill acutely at home, and this morning woke with feeling more short of breath and having trouble catching her breath. Her vital signs are blood pressure is 158 over 88. Her heart rate's about 104. Her temp was 101.3. That was the tympanic. O2 sats for 93%. So we put her on 6 liters of nasal cannula. I've got her on fluids right now. She's on normal saline at 75 an hour. We've already drawn her lab work. We've got the swab for fluid for COVID-19 gone, and chest x-ray's been done.
Okay, all right. Well, I'm gonna listen to your lungs,
Okay.
and then we will come back to let you know what the results are.
Okay. Sounds good.
All right, can you take a deep breath for me?
I heard a lot of bilateral bronchi when I listened to her earlier.
Yes, definitely.
Okay.
Okay, Ms. Miller, what we're going to do is we're going to go ahead and get you admitted, and we're going to review your lab work and your results so that we can confirm to make sure what's going on with you, okay?
Okay.
And so we have oxygen on you, and you're getting fluids right now, so hopefully that's helping you feel a little bit better, but until we get our results, you know, then we'll go from there, okay?
Okay, how long? How long?
I'm hoping it'll be pretty short, pretty quickly here,
Okay.
not too far away,
Okay.
okay?
Okay.
All right.
Thank you.
So what you thinking, Dr. Smorka?
Well, we just got her chest x-ray back and it showed bilateral infiltrates that have a glass-like appearance. And also her CBC showed leukopenia, which is a common finding in viral illnesses. So based on her presentation, vital signs, recent travel to Colorado, you know, we're suspicious of the COVID-19.
That's what I think she looks like.
Yes.
All right, well, we did the rapid flu and the rapid COVID-19 swabs. We should get those back in about 24 hours. So I'll work on getting her up to the med-surg floor and get her admitted and settled.
Okay, I'll also call Dr. Williams and give him an update.
Great. Okay, Miss Miller, we're gonna get you admitted to the hospital. I'm not sure how long you're gonna stay, but at least until you're feeling better.
Okay.
We'll probably get your flu swab results back sometime tomorrow, and then we'll know for sure, but we're really concerned that you did get exposed to the coronavirus.
Okay.
So I just spoke to your daughter and both your husband and let them know
Thank you.
they need to be on home isolation themselves for at least 14 days. Both of them feel okay now. Your husband is coughing a little bit, so I'm a little concerned that your whole family's been exposed as well. But most of the cases are very mild, and I think if we can just get you a little bit more hydrated and get you some rest and get that cough under control, we'll probably be able to get you home too.
Okay.
Now, once you're home, you're going to need to be under self-isolation as well for a little while until we
What
know
does
you're
that
symptom
mean?
free. So you're going to have to stay indoors. You're going to stay remember when I was talking to you all about having your own separate rooms? You really do need to stay kind of isolated from one another at home too. I saw that you all had cell phones, so you could FaceTime with one another and things like that, so you can kind of keep in touch.
Okay.
I'd start a good little family text chain, and then you can just keep in touch with each other. But really want you to try to do your best to rest. And then we'll keep an eye on your husband and your daughter and make sure whether or not they'll have suspected cases. And so right now we're going to wait to see if they have symptoms. And if they do have symptoms, then we're going to get them tested as well.
Okay.
Okay?
How long is the isolation?
About 14 days.
Oh, what about work? What if I need to work?
Well, you know, most workplaces are closing right now. I even heard Macy's is closed today.
Oh, really?
I tell ya. But you know, this is
crazy.
it's gonna run its course,
Yeah.
okay? And what we need to do is make sure that we don't get any more other people infected. That's why I spoke with your
Yeah.
husband and your daughter about the importance of them staying indoors and not traveling out anywhere. Okay?
Yeah.
Okay. Well, I'm gonna go call report to the floor. You're gonna go up to the 3rd floor. And then we're just gonna keep you on some fluids, try to get you some rest. We've got medicine ordered for you for your cough and for any of your congestion. You have some as needed medications to ask for, okay? And then hopefully you'll start feeling better in a day or so.
Okay. Thank you,
Okay.
nurse. Thank
You're
you, nurse. I
welcome.
appreciate
Okay.
what you've done for me here.
I'll be back in a few minutes and we'll take you on upstairs, okay?
Sounds good.
Okay.